Welcome to this explainer. I am absolutely thrilled you're here because today we are going to completely flip how you think about your body. A lot of us just look at our skin as a surface, right? Like a protective wrapper we just got to keep clean and moisturized. But what if I told you it's actually a super sophisticated, deeply sensitive biological alarm system? Today, we're diving into exactly how your skin acts as an early warning network for your internal health, specifically when it comes to your blood sugar.
79.2%. Now, that's not just some random statistic to brush past. According to a landmark May 2025 NCBI study, a staggering 79.2% of type 2 diabetes patients had skin issues. But here is the real kicker, and honestly, the whole reason we're talking about this today. An analysis of 11 years of hospital data shows these visible signs pop up on the skin years before a formal diabetes diagnosis is ever made. Your body is literally waving red flags on the outside long before your blood work catches up on the inside.
Section 1. The Hidden Alarm System. How high blood sugar damages skin. Okay, let's dive right into this. To figure out how to protect ourselves, we first got to understand the medical foundation of what's actually happening beneath the surface. And the big culprit here is chronic hyperglycemia. That's just the medical term for sustained elevated blood sugar. It acts like an invisible wrecking ball, profoundly impairing your skin's integrity. And it's so destructive because it doesn't just attack one system. It's a multi-front war. It's damaging your blood vessels, frying your nerves, and suppressing your immune function all at the exact same time. It is quite literally destroying the biological foundation of your skin from the inside out. Section 2. Decoding 7 Skin Signs, your visual field guide. Think of this section as your own personal field guide. I want you to mentally check your own skin as we go through these because recognizing these signals is absolutely the ultimate form of preventative healthcare. Sign number 1 is acanthosis nigricans. These are dark, velvety patches that typically show up in the folds of your skin, places like your neck, armpits, or groin. This is one of the absolute earliest visible warnings of insulin resistance. In fact, the data shows it affects up to 74% of obese patients with type 2 diabetes. So if you or someone you love spot these dark patches, please don't just scrub at them thinking it's a stubborn hygiene issue. Listen to your body's alarm and see your doctor right away. Moving down the body to the shins, we find diabetic dermopathy. These are light brown, scaly patches, and they're actually the most common diabetes-related skin condition, affecting up to 55% of diabetics. This brilliantly illustrates what we just talked about. These visible spots on the outside of your shins are a direct visual mirror of the small blood vessel damage happening on the inside, all thanks to that chronic high blood sugar. Next up is a symptom so many of us just dismiss as a winter annoyance: extreme dry skin and itching. But the mechanism behind this is fascinating. High blood sugar literally dehydrates your skin tissue. When glucose levels are running high, your body tries to dilute that sugar by literally pulling water right out of your surrounding skin cells. The result? Chronic cracking and a persistent, agonizing itch that no amount of standard drugstore lotion is ever going to fix. Sign number 4 is slow-healing wounds. Remember how we said high blood sugar impairs your immune function and blood vessels? Well, here are the real-world consequences. Because your white blood cell function is impaired and new blood vessel growth is totally stunted, your body's natural repair system basically breaks down. That means everyday things, like a simple scratch from working in the yard or a tiny blister from a tight shoe, turn into severe infection risks. They heal way slower, and the danger of infection just skyrockets. And speaking of infections, sign 5 is recurring fungal infections. Fungi, specifically Candida and Tinea, absolutely thrive on excess glucose. When your blood sugar is running high, that excess sugar gets trapped in your skin tissues. And this acts as a direct all-you-can-eat buffet for these organisms. If you find yourself constantly battling recurring yeast infections, or you just can't seem to shake that athlete's foot, your skin is loudly sounding the alarm about your internal glucose levels. Sign 6 is a bit different. It's called necrobiosis lipoidica. These show up as shiny, yellowish-brown patches, usually located right on the shins. Now, while this specific condition is pretty rare compared to the others we've discussed, it is highly, highly specific to diabetes. So if you ever notice a shiny patch matching that description, no way should you ignore it. It always requires a thorough medical review by your doctor or dermatologist. Finally, sign 7 is an incredibly important warning for those of you who are already managing your diabetes with insulin. I'm talking about injection site changes. A major 2026 PMC study confirmed that abscesses and scar formation from continuous insulin therapy are super prevalent.
The scary part here is that this scarring actually prevents your medication from working effectively, which completely undermines your treatment. This is exactly why implementing strict rotation protocols for your injection sites is absolutely crucial.
Section 3. The 2026 Healing Breakthrough. A new scientific hope. Okay, I know that last section was a lot of heavy information to process. But let's pause and take a breath here, because there is some truly incredible news on the horizon. As reported in Science Daily in June 2026, scientists have successfully developed a localized wound dressing carrying what's called a senolytic compound. Now, what does that actually mean for you? Well, this brilliantly illustrates how we can target cellular senescence. That's the actual biological aging process inside the cells that makes wounds in diabetics so stubbornly resistant to healing. By targeting this aging process directly, it dramatically speeds up the body's ability to close a diabetic wound. It's a massive leap forward, and it could eventually end the crisis of chronic non-healing wounds entirely.
Section 4, Your Daily Protection Plan, the Detect and Protect Routine.
Until that amazing breakthrough hits the mainstream, the power to protect your health rests squarely in your own hands. So let's focus on what you can do right now with a daily Detect and Protect routine. Step 1. You need to moisturize daily. And definitely take note here, urea-based creams are your absolute best choice for keeping diabetic skin properly hydrated. Step 2. Check your skin weekly. Inspect every single inch, paying special attention to your feet, your skin folds, and your injection sites. Step 3. If you use insulin, rotate those injection sites with every single dose to prevent that dangerous scarring we talked about earlier. Step 4. Report any wound that hasn't shown signs of healing within 48 hours to your doctor immediately. Literally, do not wait. And finally, Step 5. Control your blood sugar. Because as we've seen throughout this entire explainer, getting your internal blood sugar under control is the ultimate, most powerful skin protection you have.
So, we've covered the hidden mechanisms of hyperglycemia, decoded the 7 visual warning signs, and laid out exactly how you can build a daily defensive routine. But I want to leave you with one final vital thought. Every single day, your body is communicating with you. Your skin is broadcasting your internal health for you to see. So I have to ask, what is your skin trying to tell you today? Don't ignore the signals. Listen to your biological alarm system and always consult your doctor to keep yourself protected. Thank you so much for joining me for this explainer, and keep observing.